In a nation impacted by conflict, a humanitarian crisis and high population mobility, an Ebola epidemic has the potential to spread fast and exacerbate an already fragile situation. At least 80 people are suspected to have died of the virus in Ituri province in the northeast of the Democratic Republic of Congo, where the outbreak was first identified. Another 250 people are thought to be infected, and there are already 2 confirmed cases in neighbouring Uganda. But the World Health Organization says the scale of the outbreak could be far larger than currently detected and reported, declaring it last night a public health emergency of international concern, allowing it to release $500,000 to help tackle it.
The region where it is happening is highly volatile, with the humanitarian situation going on and the population moving around from South Sudan to Uganda and other parts. So our response is to stand with the regional government and the country neighbor in terms of solidarity to show again that they can control this outbreak.
Ebola is highly contagious, spreading through bodily fluids like saliva, blood or semen. Outbreaks in recent years have been caused by the Zaire strain, but this time it's the rare Bundibugyo virus, for which there are no approved drugs or vaccines.
In terms of the lives it could take in DRC, in Uganda, in neighboring countries, that number could be incredibly high. We've seen, very large outbreaks of Ebola in 2014 and 2012, more recently in 2018. And we know that actually, if you don't get on top of it quickly, it can spread quite fast, and the fatality rate can be up to 50%. It's a very serious disease. This is quite a low-income area. It's unstable. You have conflict. And so the worry here is that actually the countries themselves may not have the resources to bring this under control.
And will they be impacted by cuts to foreign aid that we've seen in recent years?
Definitely. And this could have been spreading for weeks, given how many cases there are. And that's because they weren't able to have a rapid diagnostic for this strain. The diagnostic that was being used to check is it Ebola was for the Zaire strain, which is what previous outbreaks in DRC were. So it kind of remained hidden because for several weeks they were not sure what this was. It was misdiagnosed, and in that time it spreads. So I think the real lesson here is to invest in all parts of the world through aid to make sure that you have the lab capacity, the infrastructure, the diagnostics, because if you can stop it there at source, then it prevents it becoming a bigger problem.
This is the 36th Ebola outbreak since it was first discovered in the 1970s, killing around 15,000 people in that time.
In the past, we would run away from Ebola patients. We leave people. We can't even handle them to give them some resuscitation, some infusions. These people need some support for their circulatory system. They are losing a lot of water. They are losing blood. They need to be supported. But now, as our care has improved, we've learned that we can reduce the fatality rate.
The declaration of this outbreak as a global health emergency will allow levers to be pulled to try to prevent a repeat of previous devastating outbreaks. But much has changed since then, with Western nations retreating from foreign aid that may have prevented its spread in the first place.